And it's
Well, I
August.
mean, people love to, who miss it, love to check in, but I don't
Right.
know about what that means about slowing down and so forth.
It
What
looks
it's
like you're recording it now, right, Diane? So we can.
let's do it. Well,
Okay. All right. So we are recording, and after the briefing, you'll be able to find the recording on our website. So please use chat to ask questions during the briefing. You can put them in there during the film at any time, and then I'll present them to Diane at the end. The chat area also turns out to be a good place for sharing information with each other, so feel free to use it for that. I'm going to mute everyone in a moment, and then I'll hand it over to Sally Ogden, another leaguer, to introduce the film and our speaker. And muting all.
hi, my name is Sally Ogden. I've been a member of the Denver League for many, many years. And normally my area is education, but my husband and I saw this film. Diane actually invited us to it, and when it was shown in the theater, and really think it's something that people should be seeing. So without further ado, I'm going to introduce Diane Dunn, who is a member of the board of the Colorado Foundation for Universal Healthcare. She's been on the board since 2016. She's been treasurer since 2020. And we were going to have a written thing of her bio, but you really need to hear this because I've known Diane for a long time through North Denver politics. But then we found out that she was a senior at Lakewood High School when I started teaching there 12 years ago. And although she didn't take my classes because I was teaching remedial reading, so she was definitely not in remedial reading classes, but her background is very impressive. She was a health IT consultant. She is a health IT consultant. She started her career as a social worker in Boulder County. Her experiences with the elderly, disabled, vulnerable adults, as well as abused and neglected children, reinforced her desire to help those who are least able to help themselves. She served for 25 years with the State Department of Social Services, which later became the Department of Healthcare Policy and Financing, working on healthcare and healthcare policy, particularly in the area of long-term healthcare, as well as in budget data and information systems. As a business analyst and with an expertise in federal reporting, Diane assured that the Medicaid management information system processed claims and reimbursements correctly. Her last years at HCPF saw her managing the technical side of the MMIS. After leaving HCFP in 2010, she worked as a health IT consultant with projects in Arkansas, Illinois, and Missouri. Most recently, she worked on the health insurance marketplace design, development, and implementation for Connect for Health Colorado. She has an MBA and holds a professional certification in project management. I was very impressed to hear all of that. So she is going to kind of introduce the film, and I think you'll find it really fascinating. So you're on, Diane.
Thank you so much. And thank you for saying you were impressed. I just assumed that you knew all that. I am very impressed by the number of people who came tonight. And I see a couple of my friends out there. Thank you for coming. This is a film called Healing Us. It has been produced out of California, but one of the main producers is a physician or a retired physician out of Utah, who is a conservative and yet is also really, really dedicated to the idea of a full healthcare reform to where we can have what we call universal healthcare, also known as single payer. There's 1,000 words for this. improve Medicare for all, whatever you want to call it. The idea is that healthcare is a right. It should be available to people without having to worry about how much we pay, etc. But a lot of it is trying to figure out, how do we get there from here? And there are a group of activists across the country that you're going to meet in this film, and I think you'll be pleasantly surprised to see what they're doing and how far the movement has come. So without further ado, I'd like to go ahead and start the film. It is about an hour and 15 minutes long. I will try my best to keep my cat from meowing. We'll see how that goes. And thank you so much, and I'll entertain all of those questions afterwards. So let's see if we can get this to share and work correctly.
Shalyn was funny. She was so gregarious and full of laughter. Shalyn was living in Kansas City. She was in school there. She decided to come back home to Las Vegas. She was so excited. She drove straight from Kansas City home to Las Vegas, 22 hours. And when she got here, she kept telling me, "Mom, look at my leg. You know, it's red and it's swollen." Unfortunately, I was on the way out at that moment to a business meeting, and you know, she's 22 and she's just moved in. I'm like, "I'll just see you when I get back. I'm so excited you're here, and make yourself feel at home and comfortable, and I'll see you in a week." Soon after I got to the retreat and I was in business meetings that I got the first phone call. She went to the emergency room with my husband, and you know, the first thing they asked her when she got there was, "Do you have insurance?" And Shalyn replied, "No." This sealed Shalyn's fate. Finally, they called me again. And I'm like, "What? Why are you calling about this?" I'm like, "Listen, just be seen. I mean, like, I'll take care of this." And like most Americans, I thought, you know, if you go to an emergency room, they're going to see you. My husband told me that at one point, they're like, "You know, it's going to be really expensive. You can leave now and it won't cost you anything." And Shalyn's like, "No, there's something really wrong with my leg." And so she stayed. The next call I got from Shalyn, she's crying. And she's like, "Mommy, they're not helping me, Mommy. I keep asking them for some testing. I keep asking them for something for the pain. They told me that I need to go get insurance and see a specialist. They're not a doctor's office." Shalyn was Black. She had sickle cell trait. She was on birth control. And she had just driven 22 hours on a torn ACL that was healing. And she had a red, swollen leg. This is one of the things that many nurses and doctors, including my sister who's an RN, told me that should have been an immediate signal that we need to do testing for a blood clot. And let's tell you what that entails. We're not talking about hugely expensive tests. We're talking about a bedside ultrasound would have saved my daughter's life. Shalyn needed to go back to Kansas City to finalize paperwork so she could start school on time. Because we didn't know she had a blood clot, she got on that plane. That night, apparently she was on her phone Googling signs of a heart attack. And that morning, my husband made her favorite meal, which was grits and bacon. And then he said, she started grabbing her chest and saying, "Daddy, please call 911. I can't breathe." And he said she kept repeating it, and she was wailing and agonizing and writhing on the floor and holding her chest. And he called the ambulance, and he got her in there, and there was complete fear on her face. My daughter's last conscious moments were in the back of an ambulance by herself, in extreme pain, with sirens going off, dying an unnecessary death. I will never forget how I felt when I walked into that emergency room. She was actually in ICU by this point. The room smelled of blood, and every time the ventilator would push oxygen into her head would fly back and her eyes would flutter open a little bit, but she was over-breathing the vent. I remember saying, "What's going on?" And they're like, "Well, she has a massive clot from her ankle all the way to her groin." We're not talking about a little clot. We're not talking about something they would have been able to detect. We're talking about a massive clot. They have pumped her with so much blood thinners that she is hemorrhaging from every orifice in her body. My baby girl was hemorrhaging out of every orifice, and all I could do was sit there by her bedside, and every time her eyes would just flutter open a little bit, I'd be like, "Shalyn, fight. Fight, Shalyn. You get through this. You're too young. You have too much to live for. Fight." I mean, I did this for hours. At this point, I knew injustice had happened. My sister had started putting the pieces together, and the doctor had said, "What do you mean they didn't do an ultrasound on her leg?" And I also talked to my husband about it, who is an immigrant from Brazil. And I remember the moment that he said, if she had been in Brazil or even Saudi Arabia, she would have had a better chance of getting care than she had in the United States in that moment.
A mighty woman stands as the icon of the American dream. Her name is Mother of Exiles, and she calls to us still. Give me your tired, your poor, your huddled masses yearning to breathe free. The wretched refuse of your teeming shore. Send these, the homeless, tempest-tossed, to me. I raise my lamp beside the golden door. And yet, in a typical year in modern America, approximately 68,000 people will die due to lack of adequate health care. 500,000 families will file for bankruptcy due to health care costs, and 240,000 people will die in hospitals due to preventable injury. That's the equivalent of one fully loaded 737 crashing every single day. It's time for change. It's time to heal. Is it possible? Are we ready? That depends on us. We the people. Here. Now.
Show you. He saw this cat and he was like freaking out. I am knitting.
I know, I love this.
With round needles, which I haven't really done a whole lot, but I've done it before. You have these needles, they can either be metal or wood, and then they have this little plastic cord that goes around and it connects it to the other needle. And then the stitches can go on the needle and the cord. So you can knit it for like hats or, things that are round.
My sister, who lives in Canada, was visiting for Christmas and she was knitting, and I just kind of wistfully looked at her work and said, "That looks so amazing. I wish I could do that." And she said, "Well, you can. I can show you, and there's so many things you can learn on YouTube, and I think it would be really good for you, Laura. I think you'd find it really kind of grounding and soothing and relaxing." And so I did. A few years later, I'd been knitting for a couple of years. I knit some of those pussy hats, and it was really neat. You could fill out, you could label your hats, and you could put your name on it, and you could put what are the issues that matter the most to me. So the hats that I sent to the DC Women's March actually had Medicare for All. So my Women's March hats had "We Need Medicare for All" on them. After that day of action, it was all over, social media and the news and everything, obviously. All of a sudden, these flashes in my mind, kind of flashing back to the aerial views of all of the pink hats. I just started thinking, we need to be crafting for Medicare for all. And then I started thinking, well, what kind of a hat? We should do berets because they're a bit militant, and I'm a veteran for peace, and beret would be the sort of revolutionary type of headgear that we need to craft for this.
The red beret is an icon of a warrior, but also at the same time showing with the red the healthcare industry. Unity, solidarity, and the imagery we project by all of us wearing red berets shows that no one fights alone.
Our whole thing is, let's do this together because we need, all hands on deck, so to speak.
We're spreading the word that Senator Annette Cleveland has never let a single payer bill out of her committee, and she has taken massive amounts of money from private hospitals, big pharma, and the insurance lobby. So we're pasting these all up around the farmers market and public places here so that people can understand that she's representing the pharmaceutical lobby instead of her constituents. So that's what we're doing.
One of the many strengths, I think, of coming at this from a creative modality is that there is something good and holistic about the labor of love, of sitting down to create with your own hands.
By getting involved in healthcare justice as Red Beret, I feel like I'm more human than before. It just makes activism accessible to everyone. You may not be physically out there yourself, but your berets are out there with people. And that's the beauty of Red Berets.
Clearly, we've had decades and decades of organizing. Something hasn't quite worked. Something, we need to get very, very creative.
Before my husband and I were married, we lived in New Mexico. We got pregnant, and New Mexico, this is before the ACA passed, but I think it's probably still the same. The insurance companies allowed a small Medicaid expansion for pregnant women, and then their children, if their children were born. But as long as the child was still alive, the child would be covered. So because I made a little bit too much money to be on full-blown Medicaid, I was working at a shoe store, I wasn't able to qualify for full Medicaid. So I got on this program that allowed my pregnancy to be covered, essentially. One day, I think I was about 3 months along, I started having severe cramps, and I went to the doctor. And they gave me an ultrasound, and they said that I was having a miscarriage. What I could do is I could have what's called a DNC, which is I don't think it would be considered surgery, but it's a way to move the miscarriage along so you don't have to go home and go through basically labor. But it would cost $3,000 because my healthcare coverage only covered my child. Well, my child still had a heartbeat. So I said, I don't have $3,000. So I went home, and it took about 4 days, and I had a miscarriage. A few months later, I get a call from the hospital's bill collection agency telling me that I owed like $400 to the hospital for the ultrasound, where they told me my baby was no longer viable. I think back to it, and one of the hardest parts was talking to the insurance collector, because he even broke down in tears. He couldn't believe that he was having to call me to tell me that I had a bill because my baby had died. And that's one of the reasons why I really am passionate about this, because I don't want any woman to ever have to experience something like that.
What is our situation?
All right, aliens, this is going to be a little difficult for you to perhaps wrap your mind around because our healthcare system doesn't make that much sense.
Healthcare systems on planet Earth can be separated into 3 categories. Most countries have healthcare systems where care is both free and universally available. The second category are nations where healthcare is free, but not yet universally available. And then there are the countries where healthcare is neither free nor universal. Among these nations, the United States is in odd company as the wealthiest nation on Earth and the country that spends the most on healthcare.
We are governed in American healthcare by the for-profit interests. It's a system that's designed to maximize profit, and it does it very well.
Our healthcare system is a profit-driven business. The conversation, the main driver is, how do we increase our customer base and how do we do it for cheaper? How do we increase our profit margin?
We have $4 trillion in the American healthcare system annually in the United States, which is by far more than any other country. On average, twice as much per capita, or as a percentage of the gross national product, is spent on healthcare in the United States. And that isn't driven by the fact that Americans are sicker and need more care. It's driven by the fact that as much money as possible is siphoned into the system, so as much profit as possible can be extracted from it. That is the underlying ground principle of American healthcare.
I come to work, I have people who are sick, they have a problem that I know I can help them with, but there's always a cost obstacle. The most common question I get asked as a doctor, the most common question by far, is how much is this going to cost? Of course, people ask me about side effects and other things, but the absolute most common question that I hear over and over again all day long is how much is this going to cost? And because we have all these different healthcare plans with all these different copays and deductibles and tiers, et cetera, I never know how much it's going to cost. It depends on so many factors. You and your neighbor could have the same name of a plan but pay different prices and have a different deductible depending on what your employer decided to do. So this is something that is affecting everyone. I'm a doctor. I still don't like going to the doctor because of concerns about cost. I don't like getting surprise bills. I don't like going and getting a service and not knowing how much it's going to cost until after the fact.
I'm Leah Perkle.
And I'm Steve Perkle. And to be honest, we were doing this fight before we even joined. Actually, before our story happened, we were already part of the Medicare for All fight. It's just we ended up having a story that kind of fits in.
Which we honestly never thought we'd be in that situation. It really hit home what we had to, because what we went through was pretty devastating.
Yeah.
Want to say when it started?
Well, we were going to a meeting about homelessness and housing affordability. And we were at the meeting, and my wife and my son thought I was falling asleep during the meeting. But I was having a heart attack. So we're at the meeting, I'm having the heart attack, and I'm not saying anything because I know I don't want to go to the hospital because it's going to be expensive, even though we had the insurance.
We kind of got in an argument that
night.
Yeah, we did, because we had to go to the hospital.
We went home, she was hungry, I wasn't, and she's like, what's wrong? And I go, I think I'm having a heart attack. And she's like, no, quit joking, because I occasionally joke. I wasn't joking, I was having a heart attack, and so...
I actually had the cardiologist come in to me, and he's like, we can't wait, we don't have time. You can't worry about the insurance company. You have to let me do my job, because if we don't do it now, he's going to die.
I find out like a day later that I didn't have a triple bypass. I actually landed a quad, so...
It ended up being, what, $135,000?
Yeah, $135. Plus, there were 2 ambulances billed. So $1,200 for one ambulance, they paid $200 on. And then over $3,000 on the second one, which they didn't pay anything on.
After months and months, they said, you make too much, we can't help you, we can't write this off. We're gonna have to turn you over to a collection agency, which is where we are now.
But they did call me up one day and tell me that if I paid it off 100% in full right now, they would give me a 30% discount. So that was very nice of them.
So it would have been about $75,000.
Oh, over that, yeah.
Yeah, which we didn't have.
But, you know, yeah, we didn't have that money, so why would they even make an offer like that? It was kind of insulting to us.
I mean, if we had that money,
So-
we would have had better health care.
Yeah, exactly.
The healthcare system in America is really a class system. If you are wealthy and you are or middle upper class, you're probably going to be okay, you know. But if you are a poor or working class person, many people just hang on to their job strictly so they have healthcare.
America, which is the richest country in the history of the world by some metrics, has an employer-based healthcare system, wherein you get healthcare through your employer, which means that if you no longer become employed, you no longer have healthcare.
To be honest with you, I was not knowledgeable about insurance, single payer, and all that. But, you know, coming from Japan, of course, like we have, you know, universal healthcare in Japan. So, you know, it was kind of a no-brainer to me, like, yeah, why don't we have that in this country? You know, we are perfectly capable of affording it. And it became a little bit personal for me when I lost my job. Because, you know, in this country, healthcare is tied to your jobs. Transgender community has great challenges in employment because, you know, some of us face a lot of discrimination. So universal healthcare, you know, gives access to like truly, you know, healthy life, you know, to a lot more people, to everyone. Well, I don't want to, you know, use a stereotype, but like let's say white person, white male from Midwest, you know, factory worker who may say things like, oh, you know, immigrants are taking away our jobs, or China's taking away our jobs. We may be farther away, like farthest away from each other, but I mean, our needs are the same though. You know, he wants healthcare. He wants healthcare for himself and his family, right? I want the same thing. I want healthcare for me, and I want the healthcare for my daughter. You know, I want bright futures for my children. He wants that too. We are not that different, you know, and if we can talk about that, I think we can come together.
Before the advent of managed care, as it became to be practiced by big insurance companies, most people got their coverage through even if it was through your employer, it was more often than not a nonprofit Blue Cross or Blue Shield plan. Insurance companies didn't really play any role in whether or not you get care. If it was a covered benefit, you could get whatever was being covered that your doctor said you need, and that was it. But when big insurance companies decided to get into managed care, that the world changed.
With insurance, because everybody has different plans with tiers and copays and things, a lot of the times it's cheaper to pay for a medication cash than it is by using your insurance, but the pharmacies don't tell you. So I've written a prescription, it's generic. I have a patient call me, Dr. Julie, that prescription was $200. I go on the website, the prescription's $22 cash. So why do we have a system of insurance where most of the time it's actually cheaper to not use your insurance, to just flat out use cash prices?
The fallout is that they're more interested, they meaning the corporate powers that be, the medical industrial complex is the term of art that people have begun using to describe that group of bigger and bigger corporate interests. They would rather make a sale than take care of a patient.
This is a profit-driven business. Make no mistake in that. And they are duty-bound. Duty-bound. They can be sued if they are not acting in the best interest of their shareholders. Not in the best interest of the patients, the best interest of the shareholders.
The reason for that is because health insurance companies are in the business to make money, and they will do whatever they can to avoid paying claims.
For example, let's say I want to order a CAT scan or MRI on you. The vast majority of insurance companies aren't going to just let me write an order and give it to you and go get that test. Like, I'm the doctor, right? I've already decided that you need this test by the fact that I gave you the order. But the insurance company is not going to pay for the test unless I basically call you and beg you to pay for the test. And I have to explain why I'm ordering this test. And when I'm talking to the person that I ultimately get on the phone, usually it's someone who, they're not a doctor, they're not a nurse. They really even haven't taken a medical terminology class because they can't pronounce the medical terms correctly when they're going through their checklist of questions they have to ask me. I'm often saying, what did you say? Because they're pronouncing words so wrong that I don't even know what they're trying to say. So I have to ask somebody who doesn't understand anything about pathology and the illness that my patient is suffering and go through their little checklist to basically get my patient the service that they need. So it's very frustrating. That wastes a lot of my time.
But these are all the downstream incentives from having this for-profit healthcare system where everyone feels like the extractive impulse comes before the kind of humanitarian impulse.
Capitalism does not work in health insurance. The marketplace does not work in health insurance. What we have in health insurance is a classic example of market failure. Well, first let me say I am a free market guy. We know what's best for us when we're consumers. We know what we like. We know what price we're willing to put into it. We make those choices all the time. We decide whether we'd rather walk or take a bike or get on the bus or buy ourselves a car and pay the insurance and drive. Those are all things we're used to trying to automatically filter through, and I wouldn't change that. But I do like to remember that the original description of market systems, which was in 1776, Adam Smith, The Wealth of Nations, gave us certain parameters by which we should judge whether market principles, the invisible hand he called them, actually will work. One of those is the buyer has to beware. The buyer has to be all-knowing. Well, he or she has to be able to think through all of the contingencies and select the right choice in the huge marketplace that's infinite out there. The second is that the seller can have no other interest than making as much money as possible from the exchange. The third principle is no one else besides the buyer and the seller must have an interest in the exchange. And the fourth thing is an observation that Adam Smith offered, which is there's an inverse relationship between price and demand in a true market. Well, the problem with healthcare is none of those apply. None of those work. There is no buyer that's bewaring. Most patients, with the exception of very few, people like myself who've trained for years, don't even have the beginnings of the clinical sense of judgment needed to decide things like, which kind of IV tubing should I have, or what antibiotic is the right one for me in this situation, or other pharmaceutical, or is this surgery that's being proposed actually one that I should agree to that invasion of my body. Most patients have no idea. They simply have to rely on the judgment of their physician. They give that over to them, and if the physician is incentivized by a market system that's profit-oriented, they could end up having their own interests, which is what a market requires them to do, and not the patient's interests, and that's a violation of the Hippocratic Oath. And we all have, to get to the third principle, we all have an interest in every one of these purchases between a patient and the healthcare system. When it's an infectious disease, that interest that we all share is obvious. If this is an active case of tuberculosis, we all have an interest in seeing that that person gets the care they need so they do not remain infectious and therefore a threat to the rest of us. But even when it's trauma and there's no infectious agent involved, we need to bring the trauma patients into a communally agreed system where we cooperate and not compete. And therefore, that group of docs and nurses is best able, who are in the level 1 trauma center, they're best able anywhere in the community to take care of those really high-risk trauma cases. That's in my interest, even though I'm not the one that's on the table. Maybe tomorrow I will be that one. Finally, price and demand are not related in healthcare. I am not a diabetic. No lowering of the price of insulin, even down to 0, makes me interested in acquiring insulin. There is no inverse relationship between the price and my willingness to demand. And that's true of all Americans who are not diabetic. They could care less what the price of insulin is. They don't want the stuff. But if you are diabetic, there is no price that's too high. You will strive to pay it no matter what, because you know if you can't get your insulin, you may die tomorrow.
The EpiPen, price gouging. Epinephrine, the medicine that's in the EpiPen, is pennies. I think I can order maybe $1.20 a vial, but I have to draw it up with a needle. And so if you're having a life-threatening emergency, you don't have time to get a vial, and you know what I'm saying? But that's like $1.50 worth of medication, and it costs hundreds of dollars. So the problem is greed.
Whether we're talking about hospitals, whether we're talking about insurance companies, whether we're talking about the drug companies, they are not existing to ensure that every life is saved and given the best care. Their main purpose is to increase the wealth of their shareholders. I cannot say that enough. I have been in the meetings. I have been behind closed doors. What they're considering is, what is the risk assessment? What is the bare minimum that we can give to people who are not insured or don't have insurance that keeps us out of litigation? That is the driving force behind businesses. It does not belong in healthcare.
Markets don't work. We have the most marketized system in the first world, and we are gasping for breath.
We are hosting a vigil for the 68,000 lives that have been lost every single year to our for-profit healthcare system. And we know that a treatment that is available would have saved their life but was unaffordable.
68,000 lives and tens and thousands more we lose annually due to the brutal, cruel, and inhumane for-profit system of healthcare that devalues and preys upon human life.
68,000 of our fathers, 68,000 of our mothers, 68,000 of our sons, 68,000 of our daughters. Not only did they leave us, but they left behind a rip in every single one of our hearts. Because they're not just numbers, they're people. They're people that have loved ones. They had fathers and mothers. They had brothers and sisters that loved them. And they were ripped from us because of our greedy healthcare system that puts profits before people. I became an activist in Medicare for All because, for the most part, I'm just a dad. But about 2 years ago, almost to the day, my son had come home to me and he had said to me, "Pops, I went to get my medicine refill today and found out that my insurance had been canceled." So I tell Danny when he came home that day, I'm like, "Okay, Danny, it's not a big deal. I'm sure we can help you out." You know, he's like, "Pops, I know I need this medicine." Words, word for word. "Pops, I know I need this medicine." I'm like, "Okay, how much is it?" He tells me it's $250. I mean, that's a big deal because we don't ever have $250 just laying around for whatever, you know? I'm like, "Okay, Danny, try to figure this out. I mean, in a couple of weeks, you have an appointment with your therapist. I'm sure she can help you out. In the meantime, you should call Fidelis and find out what happened." He found out that he missed a $20 payment for a Medicaid program, and they cut him off of a medication with a known suicidal risk. On April 9th of 2019, I read a suicide note on Facebook, and it says to us, "I can't get above this pain, and I've decided death by drowning. I've superglued my seatbelt shut, double-checked, and I'm not strong enough to break it free. For those I'm hurting, I'm so sorry. Danny, Daniel, and Hazel, I'm so fucking sorry." And he drove his truck into the Mohawk River. I saw his post 32 seconds after he posted it. So I jumped in the car and I tried race down the lake and save him. I was driving around that lake at like 65 miles per hour. This road's maybe meant for 30. Looking for bubbles, mud in the water, anything. After about 15, 20 minutes, I realized there's no way any human could have survived that long. And I had to make the conscious decision to drive home and tell my wife our boy was dead because he missed a $20 fucking payment. I vowed at his funeral that I'm going to make our lawmakers look me in the eye and see the consequences of their decisions. No human should ever be denied a medication that with a known suicidal risk or any medication because they missed a $20 payment. If me and Danny lived in Canada, if me and Danny lived in Mexico, me and Danny would still be living in Canada or Mexico.
Chargers go to work from their own 26-yard line, and they'll start on the ground. This is Justin Jackson across the 30 and out to about the 33.
He's going to get out in front of the screen. He makes the big kick-out block right there. You see the kick-out block on the linebacker, Alexander Johnson, and that opens up enough room and space for Justin Jackson. They execute him well.
My name is Justin Jackson. I'm an NFL running back. I'm a social justice activist as well as a Medicare for All activist. And my side job is kind of being a political YouTuber.
Not only has Justin Jackson thrown his political opinions into the ring, but many independent media figures consider his ideology to be one of the most nuanced out there. Joining us today is the former Northwestern running back and current LA Charger, who netted me a big win this midseason in my fantasy football league. Justin Jackson's here. How you doing, Justin?
How's it going, y'all? Thanks for having me on. I'm glad I could help you. I'm glad I could help.
And a huge reason why I am a staunch Medicare for All activist is when I was younger, when I was about 3 going on 4, my mom passed away from breast cancer. Obviously at the time, we're just as a family dealing with all the, emotional trauma that comes with that and everything. And I'm super young, so I'm kind of not that aware anyway, right? So when I was older, I wanted to kind of probe and understand what it did to my family financially, what it could have done, because I came from a middle class family, 2 parents. Mom was an accountant, dad was an engineer, just middle class. And what I found out was my mom was worried about getting further treatment, prolonged treatment because of what the strain it was putting on my family financially. She had a very aggressive form of cancer, so it wasn't a very long battle. But if it had dragged on for a year and a half, 2 years, it would have completely, probably financially bankrupted my family, even though we had insurance, right? Even though we were that middle-class family. And so just looking back on that and understanding where my family was in that situation and knowing that that same thing can happen to someone who is even less, financially able as my family was, that started to get me to understand why we have 500,000 people and families that go bankrupt every single year, right? Because they don't have healthcare. They don't have they're either uninsured or underinsured, right? So once I started relating it to my family and what could have been, that started to make it very real for me. Could my dad have paid for, having 3 kids, all of us playing sports, right? Would I have had the opportunity to play football at all? That might have never happened. I might have not be sitting in this seat right now today, right? And just because of what your cells decided to randomly start, attacking your own body, right? That's the little thing that can change someone's whole life that much. Well, no, not everywhere, but in this country, yes, that is the reality, and that's the reality for a lot of families. Now, the reason I get that help and the reason, I have great health insurance under my job is because there's money in it, right? There's money in me being taken care of. There's money in someone rushing out to the field and making sure Keenan Allen or Austin Eckler is okay, right? Because that person, that individual is making money for the system as a whole and for the individual in getting back to playing very quickly.
Keenan Allen with his first of the night, and Allen is slow to get up. Well, it's an all-out.
Now, there's actually not an incentive for a company to rush in and get you care when you need it. In fact, it's the opposite. The incentive for the health insurance industry is to make sure that if you're sick, they can find a way to cover you less or not cover you at all, because that's going to affect their bottom line. And that's inhumane.
There you go. Let's dump it. Let's see. We'll put back what we don't want. There you go. There you go. Show the needle.
It's really, really frustrating because kids are dying, you know, like Dan Strong and my son Willie died in 2007 because he had a brain aneurysm, but we had asked our insurance before when we found out that he had a brain problem for insurance coverage to get more tests done, and we didn't get that insurance coverage till after he died. Yeah. I mean, people are dying.
That's exactly what happened with Danny. When Danny found out he had lost his insurance, it was because he was medication, which is the way many people learn that they lose their insurance. He called them on April 1st or April 2nd, and that's when he found out he missed the $20 payment. He made the payment that day, and they told him that his insurance plan would be reinstated on the next billing cycle of May 1st. It was a week later that he committed suicide.
Wow.
Although his insurance was reinstated May 1st after he was dead.
Oh, that's sick. Yeah, it is.
It's like we have no time to lose. You know, this is a slow process, but it just makes me so sad because people are dying while we're waiting for insurance and Medicare for all and everything.
So one of the obstacles I keep seeing are people like my parents. They're happy, you know, they're happy with the system. There's a lot of people out there who do fall into that category, or happy with the way things are.
Yeah.
How do we cross that bridge and get them to understand that this isn't good for everyone?
Well, I think you need to convey that this is not to take away anything from you. If you like your doctor and want to keep your doctor, if you like the ability to go see any specialist without having to get a referral, whatever you like about your plan, you're going to be able to keep it with Medicare for all. But in the United States specifically, we have this more every man for themselves mentality. We don't have a sense of community wellness, right? It's more of a selfish take, you know, pull yourself up by your bootstraps. And so we don't believe that it's possible for everybody to have this Cadillac plan or this good plan. We don't believe that that's a possibility, but it is, and that's the way it should be. So we're not taking away anything from people who like their health care. What we're doing is expanding it to everyone, and we can afford to do that, and it's actually going to save us money to do that.
It is often suggested that America simply can't afford single-payer health care. But that's not what the actual numbers tell us. Here is how much other nations currently spend per capita to provide universal health care to their citizens. In the U.S., the government already spends a similar amount on a system that is neither free nor universal. This spending is funded by our taxes. Then an additional $4,000 is spent by the insurance industry. This spending is funded by our premiums and subsidized by our taxes. And still an additional $1,000 is spent directly out of our pockets. This is the cost of the profit motive in healthcare. A single-payer system would eliminate all payers except for the government and would eliminate the profit